Okay, we're going to be talking about VO2 max. So VO2 max and why we measure it is really just the maximum volume of oxygen that an individual can consume, transport, and use within a minute during exercise. And the reason that VO2 max is important is because it kind of shows you how effective your system is at really taking that oxygen and putting it into use. Because you could have really good lungs and have a really big total lung capacity, but then without being able to effectively utilize that oxygen, there's not really an optimization of the amount of oxygen that you're breathing in. So VO2 measures the gas concentration and the volume of air that you're breathing out. And VO2 max can be put into an equation in relation to cardiac output and arteriovenous oxygen difference, which is basically what we call the Fick equation. And the Fick equation here is a little bit rearranged to solve for VO2 max, and usually you would see it as cardiac output equals VO2 max divided by arteriovenous oxygen difference. But in order to, it's an interchangeable equation, and you can solve for whichever one of the variables depending on what you're looking for. So since we're looking at VO2 max, it's defined as the cardiac output, which is your stroke volume times your heart rate times your arteriovenous oxygen difference. And your cardiac output really is just the total amount of blood pumped to your heart per minute, because your heart rate is the amount of beats, and then the stroke volume is the volume of blood. Your arteriovenous oxygen difference is the amount of oxygen going out of your arteries and then the amount of oxygen coming back in your veins. So when blood is pumped out of your aorta, it usually is at 100% oxygen saturation, because you've just received fresh oxygen via gaseous exchange through the pulmonary vein. So that's 100% oxygen saturated blood that enters your muscle tissues. And then your venous return is the blood leaving your muscles, returning to the heart with the remainder of the oxygen you have. So at rest, because your muscles are not using huge amounts of oxygen, the arteriovenous difference is small, whereas during exercise, when your muscles need to take this oxygen for metabolic demands, then the venous oxygen rate will be a lot less and the difference will be bigger, because the arteriovenous difference is just the oxygen saturation of the arterial blood minus the venous oxygen content. So to increase VO2 max, your muscles must be able to effectively strip oxygen from the blood with higher efficiency. So a large arteriovenous difference would indicate that your muscles are more efficient at taking that oxygen from your arteries and using it effectively. And then if we look at endurance adaptations, we can actually see when an individual trains more, there are actual physiological things that happen within your body. And the first one is increased capillarization, which means that your capillaries can branch out more and there's an increased surface area for oxygen to diffuse through your blood. And it maximizes the efficiency of delivery. And the second one is you have an increased mitochondrial density, which helps increase the consumption of oxygen, and it lowers the partial pressure of oxygen within the cell, creating a stronger pressure gradient. Also makes sure that you have more mitochondria to produce the energy and ATP you need to constantly be moving. And these are obviously endurance adaptations, so they're training from aerobic exercise. And then the third one we have is increased cardiac output. So this, because your heart is a muscle, and a key characteristic of muscles is that they go through hypertrophy, which is when they increase in both muscle mass and the muscle fibers, the number of muscle fibers. So your heart also increases with size, and if your heart increases in size, it can contract more powerfully, which increases your stroke volume. So the amount of blood that can be ejected per minute. It's like how hard you can push a button if you're super weak versus super strong. And then the mass of your heart also increases, and your beats per minute can decrease because you're working at a higher efficiency and you don't need to put as much power in to get the same amount of blood out. So that's why people who are highly trained, especially like really, really elite runners, they have like resting heart rates that lie at around like 40 beats per minute, because they just don't need to use your heart so much because they have such a strong muscle that it only takes 30 beats per minute to keep at a constant delivery rate, whereas other people usually have a resting heart rate at around like 60-75 beats per minute to ensure that their body is constantly circulating. Yeah, and then that is mostly everything for VO2 max. So maximizing oxygen uptake within your body.